Hi, I'm Dr. Ryan at Gantling Dental, and today I'm here to talk to you about dental implants.
Dr. Ryan, what are dental implants?
Dental implants are an artificial tooth root that is surgically placed, and it is used to anchor the tooth that would be missing. And the tooth that would be missing could have been from a previous bridge that was placed in your mouth, and or is just a missing tooth.
What are implants made of?
Most dental implants today are made of titanium, and that's a very good substance. It's biocompatible, and it bonds well with bone.
Who places the implants?
Most of the time, dental implants are placed by the oral surgeon. They can be placed by a general dentist, and that's completely, it can be a good thing, but you want to make sure that dentist is well trained. Again, you don't want to find a dentist, in my opinion, find a dentist that has had just a weekend course on placing implants. You want to make sure that they've taken a lot of education, considerable amount of dental hours training to place the implants. So a general dentist can place the implants, but most implants today are placed by an oral surgeon.
How are implants placed?
Implants are placed by the surgeon into the jawbone, and it's usually it can take for one implant it can take anywhere from 1 hour to several hours. But what they do is they anesthetize you, and you would not feel anything, of course, and they would place the implant up in the bone, and most of the times they will seal that up. So when you leave that day, you wouldn't be able to see any implant sticking out. It then integrates in the bone. It takes anywhere from a couple weeks to several months to integrate into the bone. We are seeing and we are restoring implants today that are single stage, where they're placed and the part of the implant is you can see it when you leave the surgeon's office. And so and they're having very good success with that. But the key there is getting integration with the bone adhering to the titanium and getting ready to be restored.
Who should get implants?
Well, dental implants are not an option for everybody. Candidates would be adequate bone, healthy individual, taking good care of your teeth, keeping plaque levels at a minimum, seeing the dentist regularly. Even if there isn't enough bone, there's ways to augment the bone and get the bone. One thing today we're seeing more and more of is denture wearers who may not enjoy their dentures or not having good success with their dentures, especially lower dentures, are having dental implants placed, maybe 2 dental implants on the lower, maybe even more. So those are very good candidates. Again, bone level is important, anatomy, where the nerve is, all those are issues that you'd want to discuss with the surgeon, or even if it's a general dentist placing the implant part.
What is the difference between implants and dentures?
The difference between implants and denture basically is implants are fixed, and where dentures are removable. And dentures might not offer as much stability as implants in your mouth and as you're functioning and chewing.
How do I care for implants?
Well, poor dental hygiene is one of the main reasons for failure of implants. So hygiene is the most important. Proper brushing and flossing of implants. Your dentist, as you restore the implants and get everything finalized, will go over that with you. But basically, you want to treat it almost like any other tooth in your mouth and do the best job you can with home care.
How will I adjust to implants?
Most people adjust to implants immediately. It's very similar to maybe having a crown placed. There are times, however, that patients may take a little bit more time adjusting to some maybe post-operative tenderness, some sensitivities. It's very important that you know with your dentist to make sure that the way the final tooth of the implant hits together or is in occlusion is not going to interfere with the workings of your mouth. So that, to us, we find that is one of the reasons we see any problems arise would be for that reason. So it's very important that you have a dentist that would pay particular attention to how it functions.